You're very welcome to today's talk. It's Monday the 15th of March. Now I want to focus on what's going on in Europe for this talk really, but there will be a report from Australia as well, so hang around for that. Now in Europe, mainland continental Europe, to be quite honest, things aren't going very well at all. Let's just have a look at some figures on that. So basically now we are in a European third wave. I think that's the only thing you could really call this. And in this race between infections and injections, the vaccinations in Europe, the infections seem to be winning. Now I am fairly optimistic that in the UK the injections will beat the infections, that the vaccination will generate a degree of immunity and protection from the illness that's going to prevent a resurgence of a third wave, at least in this spring and summertime. And in the United States, it's still kind of a bit either way in the United States. So I'm fairly optimistic about the UK. I'm hopeful that the infections are going to lose in the United States and the injections are going to win because of a massive increase in injection pace in the United States, which is encouraging. But I'm afraid in Europe, the battle is currently being lost. And this is, of course, a complete tragedy. More people are dying, more people are getting sick, as well as the socio-economic impact as well. It really is a sad situation. Changes over the past 2 weeks, just to give some broad figures. Now, this is mostly powered, as far as we know, by the UK variant, the British variant, the Kent variant, the 2012, the B117, the variant that was first identified in the UK. Probably first identified in the UK because of the excellent genomic sequencing we have in the UK. The genomic facility in the UK was set up to do 100,000 genomes of individuals around the UK to study cancer mostly, actually, and to study the relationship between the genome in humans and disease. But when the pandemic came along, they had the technology kind of just sitting there waiting to be converted into viral genomic analysis, which is of course exactly what they did, which is why the UK has got by far the best. Denmark's also got very good facilities as well, but in terms of numbers being done, the UK is by far and away leading the world actually. But it was fortunate. That bit's not particularly good judgment, but that's just why we discovered it there first. We believe whether it arose in Kent or whether it came, we don't know. No point speculating. Right, Italy, now cases in Italy are up 54%. France has more or less plateaued at 1% increase. Germany cases are up by 90%. Now these figures here in brackets are the percentage of the total cases in the country caused by the new variant. So in Italy, 54% of the cases are caused by the new variant. In France, it's 65.3%, and in Germany, it's 9%. Now, this is exactly what we predicted actually on this video a good month ago now. It was fairly obvious this was going to happen because the cases increase, the new variant increases exponentially once it gets to a certain critical mass. And then it will level out again, but it will level out perhaps in the mid to high, well, around about the 90% plus of cases. So the fact that it's 54% of the new cases in Italy now means inevitably that that's going to rise. So pretty soon in Italy, France and Germany, the UK variant is going to be about 80, perhaps 90% of cases. And the obvious implications of that for transmissibility. And although the increased risk of death is not great in overall figures, that is going to transpose to increased deaths in those countries inevitably. So it's really a very unfortunate situation in these European countries. Now the seasonality effect will kick in; it will start to have some effect, but at the moment it's not. So new variant, 46.1% in Germany. These numbers will inevitably rise. Now we don't have detailed numbers for the new variants in other European countries, but we do know in some of them it's a significant factor, but the genomic analysis is not really good enough to give firm figures, unfortunately. But we do know it's in the Czech Republic, for example. We know it was the major cause of the a tremendous increase in cases there's been in the Czech Republic, and we know that tragically in the Czech Republic people have been dying, and they've had to send some of their critical care patients to Poland because they've simply run out of critical care capacity in the Czech Republic. So Netherlands cases are up by 3%, fairly bit of a, well, it's still going up though. I mean, it means the R naught's above 1. Sweden, it's up 6%. Estonia, we did look at Estonia recently, up 58%. Poland up 63%. Huge increase in Poland in cases. Again, we assume that the majority of these are the new variant, but we don't actually know. Austria, great increase in cases. Hungary, more than doubling in Hungary. Serbia up by 29%, Greece up by 48%, Spain and Portugal thankfully down on the Iberian Peninsula. So it looks like the overall prevalence is lower on Spain and Portugal on the Iberian Peninsula. Now, why Italy is up by 50% and France just 1%, it's hard to say. I mean, all we can say is this is the emergent increase in cases as a result of the totality of gross national behaviour and other mitigation strategies that are being taken nationally. So there we are. It's really a fairly pessimistic picture in Europe, and needless to say, the average man and woman, child in all over Europe are not very happy about this. So Italy, for example, La Repubblica, which I've pronounced wrong, apologies to Italian-speaking viewers. It's one of the major newspapers in Italy, though. Direct quote, "Fear has turned to anger and exhaustion." And I'm not surprised. Italy's had such a hard time for such a long time now. They really do not need a 50% increase with 54% of the new variant, and yet this is going to carry on increasing. Direct quote from La Repubblica, "We're waiting for vaccines like prisoners in a Western movie surrounded by Indians, scanning their horizon and waiting for the Seventh Cavalry." But there's problems with the arrival of the vaccines, unfortunately, as we're going to see later on in the next video, see how we go for time. Extensive local measures are now being taken in quite a few parts of Italy, especially in the highly populated area around about Rome. Governor of Italian district, "It's clear that we are in the third wave all over Italy. That is necessary to take exceptional measures." And the Czech Republic, some epidemiologists have been speaking off record in the Czech Republic, saying they could actually reach herd immunity just as a result of the infection. Now, of course, that sounds good, but of course we know that whatever it is, 5 or 6% of people who get this illness get really quite ill. We know that normally about 0.4, 0.5% die, and without medical care the number of deaths will be way, way higher. And as we know, the Czech Republic has already been sending patients overseas for treatment. So it's not good in mainland Europe. UK has had no third wave. Now, I happen to live in the UK, but I mean, there's no. This is just distressing for people in Europe. I mean, I've taught in various countries in Africa and Asia, and the whole point is to reduce human pain, suffering, and death. The background, the politics, only interest me in as far as they affect the well-being of the individual. And here we see tens of millions of individuals in Europe who are not doing as well as we would like. Anyway, back to the point. Last week in the UK, so this is sort of fairly broad data from the UK, but it's data from a week ago, but it just shows the trend. Well, it's the data over the past week. COVID cases dropped by a third is the headline in the COVID symptom tracker app. This is based on 1 million weekly reports and 7,600 recent swab tests. Now, we do compare and contrast the COVID symptom tracker app data with the official data. So today we're using the COVID symptom tracker app data. They are remarkably close. Of course, remember the COVID symptom tracker app data slightly underestimates the total number of cases because it only looks at symptomatic cases. So 12th of March 2021, increase in cases per day 5,494 to be technically correct. Symptomatic cases per day. Last week it was 8,111. So we see this dramatic decrease from last week to this week. And for the week's figures, it's down 32%. So this is an excellent reduction in the UK. The prevalence is 1 in 613 in the UK over that last week. No, I think that's the prevalence now. 1 in 613 in the UK currently have symptomatic COVID. So that is as of now. So 1 in 613. But the previous, coming up to this time, it was down 32%. So the R0 in the UK over that week, the past week's data, UK overall it was 0.8, England it was 0.8, Wales slightly higher, Scotland it was 0.8. And today, I've checked, actually this was as of late Sunday evening, the UK R0 is between 0.6 and 0.8. Probably nearer the 0.6 than the 0.8, but we don't have sufficient data to say exactly. So that is really quite a marked contrast between most of mainland Europe and the United Kingdom, where things are going much better. Now, we need to look at the vaccines here, because there we go. So European Vaccination Progress, 7-day average per 100 people for vaccinations. Now, in the UK, we see January, February, into the beginning of March, and we see this. This is the UK line here. This really pretty good increase in number of vaccinations. This is France, Germany, Italy. The line is basically the same. So France, Germany, Italy doing the same number of low number of vaccinations, and the gap, if anything, is increasing between the UK and the European level of vaccination. So it really is a pretty sad situation in Europe. Now, Germany's used less than half of its stocks of AstraZeneca vaccine. Now, part of the problem here was this idea that the AstraZeneca vaccine was quasi-ineffective, was, I believe, the Mr. Macron's expression. Was quasi-ineffective. So in Europe and quite a few European countries, as we know, stopped use of the Oxford AstraZeneca in the over 65s. And the idea that it was a useless vaccine seemed to get out into Europe. And this has caused big delays in the programme. Because we know the efficacy of the Oxford AstraZeneca vaccine is good from lots of data now. Germany used less than half of its stocks of AstraZeneca vaccine, apparently. It's only used a third of its stocks of Moderna vaccine. What is going on here? Why aren't they not getting this out? 3 million over 80s and high-risk individuals still unvaccinated in the modern, sophisticated country of Germany. We know some of the details, we've talked about them before, but really it's quite a lamentable performance for a country of Germany's extremely high calibre and intellectual and organisational abilities, and yet it's incredulous, really. France used less than 3/4 of their vaccine stocks. In other words, they've got a quarter left sitting there doing nothing. Belgium apparently has used less than a third of its vaccine stocks. Public reluctance to take AstraZeneca, perhaps after the bad publicity that some of its leaders gave it, and bureaucracy incompetence is being reported from several European countries by quite a few popular news outlets. Now, in contrast to this, the UK vaccination programme, as we've seen from the graphic, is going really quite well. So a third of the adult population now vaccinated in the UK. As of today, Monday the 15th of March, most areas are now calling in people over the age of 56. And it's going to be over 50s later this week. So this is a dramatic increase. And we're expecting an increase of 1 million doses per day, up to 1 million doses per day this week. So the record day in the UK at the moment is about, I'm not sure, around about 550,000, give or take. They're expecting to almost double that to 1 million doses per day. And this is partly because of the Moderna vaccine. Now, the UK did order 7 million doses of the Moderna vaccine, and we've been able to increase that. I think we're up to 17 million doses arriving in the UK. So the Moderna vaccine is arriving in the UK and is going to make a huge, brilliant, beneficial splash when it arrives. It's going to greatly increase the amount of people we're vaccinating. So we've been vaccinating with the Pfizer for a while, the Oxford AstraZeneca, and now the Moderna arrives. And I would be delighted to have either of those 3 vaccines. I would just turn up and be grateful for any one that I was given. It's just over 3 weeks now since my first Pfizer vaccine, which I'm happy for that. I would have been happy with any of them. So that is going to be a great increase in the UK distribution. So the top 9 priority groups that we've looked at, that's the government link for them. You can look at them there. But increasing age group, people with comorbidities, healthcare providers. Group 9 is all those over 50. So once everyone over the age of 50 is vaccinated, that'll be the top 9 priority groups ticked off. That'll be 32 million people we've vaccinated, and we're hoping that's going to happen by the 15th of April. Today being the 15th of March, so within a month, that 32 million people, everyone over the age of 50, all the healthcare providers, the care providers, all those at high risk, we are hoping to be vaccinated. 4th of April, it's probable on this schedule that over 40s will be offered vaccination by the 4th of April. And the 31st of July, it's hoped to reach every person over the age of 18 in the UK. This is just quite spectacular progress. Now, I do have quite a lot more to say about vaccine safety, and I know many countries have suspended use of the Oxford AstraZeneca vaccine. But I'm going to do that in another video, because I want to go on to Dr. Oliver now, who's going to bring us a report from down under. So, Susan, thank you very much, ma'am, and over to you.
Susan again from Sydney, Australia, where it's currently very cold and very rainy. Now, last time I gave you an update, I said there was 0 cases in Australia. Unfortunately, that's no longer the case, and we now have 2 locally acquired cases. One is a doctor from Brisbane who was treating some COVID patients, and the patients had the UK strain, so most likely she will as well, but we're still waiting on genomic sequencing for that. The other case is a Sydney hotel quarantine worker, and we don't know yet what variant he has because he was in contact with a number of positive cases. Now, the Brisbane doctor hadn't been vaccinated yet, but the Sydney hotel quarantine worker had with the Pfizer vaccine, but it was only 11 days since his vaccination. And as we all know, that's not long enough for an immune response. The good news is contact tracing is underway in both states. Most close contacts of the 2 cases have been identified. They will all go into isolation. So far, all tests have come back negative. That doesn't mean they'll stay negative, but they're in isolation. So hopefully there won't be a lot of spread. And so hopefully we have good news. We do have more concerning news from one of our close neighbours, which is New Guinea. Now, contrary to what some commentators think, Australia isn't thousands and thousands of miles away from our nearest neighbour. New Guinea is actually 150 kilometres from the Australian mainland and 4 kilometres from the Torres Strait Islands, which are part of Australia. Now, sadly, it looks like COVID is now out of control in New Guinea. This isn't really reflected in the official numbers, which still are under 100 cases per day, but there's very little testing done in New Guinea, so we think that the numbers are unfortunately a lot higher. And this is quite concerning because New Guinea is quite a poor country and they have a fairly poor medical facilities. And they also haven't started vaccinating yet, but they will next month, and they'll be getting their supplies from the COVAX scheme, which Australia is a part of, and as are a lot of other countries around the world. And I mentioned the Torres Strait Islands, which are part of Australia and 4 kilometres from New Guinea. We will be vaccinating everyone on the Torres Strait Islands as a matter of urgency. Now, just on vaccines, we are now, unfortunately, officially behind schedule. We were hoping to have 4 million people in Australia at least receive their first vaccine by April. We're just not going to make those numbers. This is mainly because of the supply issues. We were expecting to have 4 million vaccines in the country by now. Instead, we have 700,000, and that's because we can't, as I mentioned in my previous update, we can't get them out of Europe. We've currently vaccinated about 150,000 people. If you're wondering what's happened to the other 700,000, we do batch testing on all vaccines that arrive in Australia, and so that is why. So until they're batch tested, they're not used, and that's just so safety first in Australia. Now, just on the vaccines, a little bit of extra news. Something that we're doing in Australia, and I know that Dr. John doesn't really agree with this, but there has been some vaccinations of prominent people. This was done with both the Pfizer vaccine and now with the AstraZeneca vaccine. And the reasoning behind it is that there is a lot of vaccine hesitancy, and there's also a bit of vaccine snobbery with people saying, I want this vaccine, I want that vaccine. So essentially, a number of politicians and also chief leading scientists are actually getting the vaccine just to show it's safe, it's effective. Now, in a case of the worst possible timing ever, our health minister Greg Hunt got the Oxford AstraZeneca vaccine one day, and then the following day was admitted to hospital. Now, I'm being flippant about this because he's now been released and he's absolutely fine and will be back at work tomorrow. But of course, it didn't stop everyone going, he's been vaccinated, he's in hospital. Now, what actually happened was the reason he was admitted to hospital was because he had cellulitis in his leg. Now, for those who don't know, cellulitis is a skin infection. So, vaccine in arm, skin infection in leg. Obviously, they're not connected, but it's just how the media and people react. Anyway, over my time again, so stay safe, everyone. Thank you.
Susan, thank you again for another quite excellent update. I am back on, aren't I? Yes, I am. Sometimes I forget to switch my microphone back on. Right, okay. Just think how many countries would be just so delighted to say, we had 2 local cases in the last few days. Dear me. Concerning in New Guinea, I wasn't aware of that. I know a lot of professionals in Australia do have links with New Guinea, and I would expect that there should be some synergistic working there pretty soon between Australian and New Guinean expertise. Greg Hunt, the cellulitis, very common. Very often a staphylococcal infection, nothing to do with the vaccine. So now Susan mentioned there about me not really approving of this under the circumstances in Australia. If this is your opinion, Susan, I'm more than happy to go with it. Politicians are one thing, but for prominent scientists to get vaccinated, I think that's probably it is a good example for the population. So I am happy to make an exception for the Australian situation. And let's hope these vaccines come pretty soon. We know they're going to be making about 50 million doses in Melbourne. I'm pretty sure it's Melbourne this year. So it is going to happen in Australia. It is a pity about the delay. I wish we could say there'd been 2 local cases in the UK over the past week. That would be pretty tremendous. Okay, that is us for this video. Thank you, of course, for watching, and thank you, Susan, for that excellent report.